What is nasogastric tube feeding? Feeding through this tube provides you with proper nutrition when a medical condition prevents you from ingesting food through your mouth. Fluids and medicines can also be given through the tube. The nasogastric tube is a narrow, clear plastic tube that is passed through the nose, down the back of the throat, through the esophagus, and into the stomach. Your loved one may require this tube temporarily or longer, depending on his or her medical condition. Let's start to prepare for nasogastric tube feeding. Prepare formula feed. First, wash your hands. Prepare the feeds. There are two types of feeds available: the liquid formula and the powdered formula. The liquid formula may come in a packet form or in a can form. Let me show you how you can prepare the liquid formula. Firstly, you need to check the expiry date. Shake the can package well. Wipe the can top before opening. Measure the correct amount of formula feed. Please note to check the amount at eye level. You may warm the formula feed in a bowl of warm water if it is cold. Do not warm the formula feed in a microwave oven or boil it, as this will destroy the nutrients. You may cover and keep unused formula feed in the refrigerator, but it must be used within 24 hours. If you are using powdered formula, check for expiry date. Use the correct amount of powder to water according to instructions. Check that the powdered formula is well dissolved in water. Prepare your loved one. You will need to perform suctioning, oral hygiene, or turning for your loved one before feeding. Do not feed if your loved one appears to have difficulty in breathing, coughing or choking, restlessness, drowsy, confused, nausea or vomiting, diarrhea, abdominal pain or bloated stomach. Check tolerance to feed. Check the tube position. 60 ml syringe. A bowl or a cup to hold the withdrawn content, and a box of tissue. Let's start to aspirate the stomach content. Kink the feeding tube. Remove the spigot. Connect syringe tip to feeding tube. Gently draw back plunger to withdraw stomach content. Note the amount, color, and nature of content. Reconnect spigot to tube. Now, let's start the feeding. First, wash and dry hands. Remove plunger from syringe. Kink the feeding tube. Remove the spigot. Connect the syringe tip to feeding tube. Hold the syringe at the level of your loved one's forehead. Pour formula feed into the syringe. Unkink the tube and allow formula feed to flow in slowly. Please note, do not allow the syringe to become empty during feeding. This is to prevent stomach distension caused by air entry. Flush tube with recommended amount of water after feeding to clear the tube to prevent blockage. Kink the tube after flushing. Remove syringe. Connect spigot to the tube. Keep your loved one in upright position for at least 30 minutes after feeding. This is to prevent backflow of the stomach content. Please stop feeding if your loved one appears to have difficulty in breathing, coughing or choking, showing restlessness, drowsy or confused, or having nausea or vomiting. Points to note: clean and dry feeding items before and after use. Keep nose area clean. Change the anchoring tape when required. Clean the mouth at least 3 times a day.